Welcome to another edition of Living with Purpose. My guest today is Washington State Senator Vandana Slatter. She represents the 48th District. Dr. Slatter is also a pharmacist, and she is a trained scientist, having had her first 20 years serving in major pharmaceutical companies in this country, and then decided to actually serve and join the Bellevue City Council in 2016. And then she has also served as the Washington State legislator and now as a senator. So please join me in welcoming Senator Slatter to Living with Purpose. Welcome.
Thank you so much, Nectar. It's wonderful to be here, to be with you.
So, interesting journey.
Yeah.
Indian American descent.
Yeah.
Very few women of Indian American descent in politics at any level. You grew up in Canada. So talk a little bit about your growing up, the environment in which you grew up, your parents, and how that influenced you to where you are today. And I also want you to touch on a little bit of the fact that you were a fencing champion.
Of course. Thank you so much, Nectar. Yes. I usually start by saying I'm the eldest of three daughters of parents who immigrated from India, as you noted. They came in the early 1960s. My father grew up on a farm, and it had an outdoor kitchen and no running water, but it was a very large working farm near Lucknow, India. He came to Canada 60 years ago to continue his medical training as a medical doctor. And I was born and raised in a town in BC, Canada, northern British Columbia, Canada. And for the last 30 years, America has been my home. But my dad empowered us and my mom was fearless. They taught us to take the best of both cultures, work hard and dream big and support family and community. So as a young girl, I still was expected to mow the lawn. And when you're living in northern Canada, you also have to shovel the snow. And we all became skiers and lived in this sort of rural life, up in northern British Columbia, where it was, pulp mills and timber and sort of this expat community, essentially, of physicians and people who had come from other countries. Because a lot of times when you come from another country and you have a skill set, you're often sent to rural areas or places that don't have those experts. So it's kind of an interesting.
Let me just ask you a question. So your father moved to British Columbia because he was practicing medicine.
Right. Oh, yes. Good question. I'm anticipating your question, I think. He graduated from Lucknow Medical College, King George Medical College in Lucknow. And then he continued his training, residency, and whatever that extra licensing was by applying to Canada and the United States. And Canada accepted him. So he came as a single person here in 1960, and he practiced in Nova Scotia and in Montreal, Canada, and eventually went back and married my mom, and then came back and moved to British Columbia to open a practice in northern BC. Started in Vanderhoof, that was where I was born, and then 2 weeks later they moved to Prince George, which is probably the largest regional center. So it was still a journey for him too, right? To come to Canada and to build a practice, build his medical practice or medical training. He's very young at the time, and so that's where I was born in 1964.
So you're growing up. Siblings?
I have two younger sisters. Yes, I'm the eldest.
And you went to schooling there.
Yep. In public school for 12 years, and really very small Indian community. There's some people that, but mostly in school, I did not have too many people who looked like me. I would say none in my first elementary, intermediate, and then ultimately high school. We graduated about 1,000 of us graduated in my 12th grade, like my senior year. And that's because it was a regional center. So a lot of the smaller communities would send students into this, the biggest center. And, when we graduated, there were two classes of 500. And I remember the photograph. It was me and it was two other young women who were people of color in this entire class. And so it was a very integrated experience being in community, straddling two different cultures.
So you grew up there, and is that where you took up fencing?
In high school, I graduated high school, and then I did fencing actually in university when I moved to college.
And where did you go to college?
I went to the University of British Columbia, and I went to, it was science, first year science, and then I applied to pharmacy.
And how was that? I mean, so you've come from a small town, again, immigrant community. You come into British Columbia and Vancouver, which is a much larger city, very diverse. So talk a little bit about your experience there and how did that shape what you landed up doing?
Well, I mean, I have to say that my father had come on his own, but after he came, other people in my family came too. His brothers, his cousins would also came to study. So we had family in Vancouver and we would drive to Vancouver. It's a 500-mile drive. Like it depends on how, like about 10-hour drive. Yeah. And it was beautiful. I mean, along the Fraser River. And so I was used to going to Vancouver and seeing family there. And it was a much bigger diaspora, Indian diaspora there. So that's kind of where a lot of the cultural connections happen too, right? Where you could, go to events, people would wear Indian clothes. There would be a lot of different opportunity to be part of the culture. So I was familiar with Vancouver. I understood, UBC was, in Canada, you have like a number of really great universities. There's not as many as there are in the United States. So in British Columbia, you had UVic, University of Victoria, University of British Columbia, Simon Fraser University, pretty much the three main schools. And if you wanted to do science, which is what I wanted to do, then UBC is sort of the top. And so that's where I applied.
And you spent 4 years there.
Yeah.
And how was that environment? And, give me...
I mean, very interesting because, I lived in the dorms and we didn't have cell phones in those days, right? So every week I would go to the payphone that was at the end of the hall and I'd call my parents. And, it's a different environment. You kind of have to figure it out. Luckily I had my uncle and aunts for help and unloading a dorm and moving from one, place to another, that kind of thing. But also just having some family connection. It was great. I did want to do skydiving actually in my first year. I was 17. But I still thought skydiving would be really cool. They had a clubs day, so I went and checked that out. And they told me I was too young. I couldn't sign the insurance form. So I decided to walk around and see what else there was. And there was a woman who was teaching fencing. And she was sort of demonstrating fencing. And they had these great videos up, Monty Python, the Black Knight, and Star Wars, and things like that. And I was fascinated. So I was watching, the demonstration. She noticed that. And she said, if you're really interested in this, you should come and try it out. We have this 2-week trial period for a fencing club at UBC. So I did. I went and I tried it out. And the coach who was there happened to be an exchange coach with hockey. And he had come from Poland. He was I think it was a national team or Olympic coach in Poland, and he was training. Because it's such a small sport, you could get sort of access to really high-level athletes and coaches. And so he was there for a number of months, and I was able to learn fencing, and I just loved it. I'm not tall. I'm like 5'2". And so, doing a lot of different sports. I love basketball, but I was never going to be able to play, significant basketball, maybe just for fun. And I love to ski, but that, you're probably got to get to it. You have all the equipment and everything. And so this was just really amazing. And I found I had some talent in it and I really enjoyed it. And so eventually I became captain of the women's team, which is about 3 of us. There's 30 guys and 3 women. And, and ended up winning a junior championship, and really enjoyed it.
And from a studies perspective, you decided to go into pharmacy.
Right. I was very resistant to it. Initially, my father said, he's a physician and he used to see, pharmacists in our neighborhood and in the town. And he noticed that, women could work, they could have a family, they could have a really good life and career. And he always told us, that our mind is one of the most important things that we had, that people could not take that away from you. And he wanted us all to have a profession. And he would say, we're 3 girls, he would say, you never know what's going to happen in your life. And it's really good for you to be able to have something that you can rely on in case something happens, whether it's to your husband or family or to yourself. At least you have your mind and you can go and work and have your own income. So he encouraged me to do pharmacy, and I was really not interested in that. I had done 1 year in science, and I really loved neurobiology. But, he was paying for my education at the time, and he was pretty strict, and he said, you can do that if you want to, but I would just ask that you have this career, that you have a profession, that you can sort of say that you have this ability, this role, and this skill set. And then if you want to go to medicine, if you want to go to neurobiology, feel free to do that. So I ended up going to pharmacy, and I was kind of rebellious. So I immediately, I think my lab, I didn't pass my lab, which is a problem. You have to pass your lab first class. And my lab instructor, she could see sort of what was happening. And she said, either you're committed to this or you're not. And so I really had to think about it. I really had to do some soul searching and make a decision. And I realized that it really mattered to me to do well in that. And then I had learned some things, and I realized that this was actually a pretty fascinating field. And so I went back, and I was able to make it through and become a pharmacist. And I ended up becoming a hospital pharmacist. And that was a lot more fascinating to me.
And then did that get you to move to the US, or how did that happen?
I got married to Greg Slatter, Canadian scientist, and he had a postdoc at the University of Washington. At the time, I had graduated from pharmacy school, and in Canada, there were no clinical doctorate programs. This was kind of new. And so Canadians were going down to South Carolina, to Pennsylvania, and the University of Washington had just started their program to do a doctor of pharmacy. And I was thinking, well, I'd maybe like to practice for a little bit before I do this. But if we were going to move to the States, it made sense to me to move there as a student and to continue my education, because I really wasn't sure what the future was going to hold. Mm-hmm. So I applied to the doctor of pharmacy program. I'd already done a residency, and they didn't require residency for one of their paths, which was the PharmD only program. So I went ahead and I joined the PharmD only group, and there was three of us, and we were part of the whole doctor pharmacy program, and it was actually a really amazing experience.
And then, so that kind of completes your studies. You then start going and working in companies. You're enjoying a great career. Talk a little bit about that, and then how did that shift to politics happen?
Yeah, trying to find that 10-year nonlinear path. Yes. Well, usually what yes, it was 20 years in biotech. It was, first of all, we moved to Michigan, 10 years in Michigan. Greg had a position as a scientist, and I joined Battle Creek Health Systems as a staff clinical pharmacist. And, we had one car. So Greg would take the bus and I would take the car to Battle Creek, which is about 30 minutes away, when we lived in Kalamazoo, Michigan. So that was my start to work. I had done some work at Children's Hospital here in drug and poison information here, but it was only for a few months before we moved to Michigan. I had to get my license and all the law and everything, the reciprocity. But anyway, so 10 years in Michigan where I had my son. And I do tell that story about why it matters to me about government policy, because it actually made a very big impact in my life. I can come back to that if you like, and just tell you how we got back to here. But ultimately, we moved from Michigan to New Jersey, stayed with industry, and then I was with Pfizer. And Pfizer was offering people positions in Michigan again, and I didn't want to go back to Michigan. I said, Greg, I think it's time for us to go back to the West Coast. I really missed it. And so he got a position at Rosetta Biotech in Kirkland, and I didn't have a position. I had taken a severance with Pfizer, and I decided, I need to rethink this, because I do like drug development, but I was seeing that we weren't meeting the needs of the entire world, right? Like we were meeting the needs of the developed world, but not the developing world. And one of the medicines that I was working on was very useful in that space, but the infrastructure just wasn't there. So I became kind of fascinated by the idea of the Gates Foundation or PATH, organizations like that were actually doing this kind of work, but in different parts of the world in a way that could kind of meet the needs of people that we weren't necessarily addressing. And I took an executive MPA program in order to sort of get my head around, how do I sort of move from the private sector to public service. I knew what it was like to be in health, but I really wasn't sure what it was like for administration. Frankly, that's not exactly nonprofit work, but it was partly that. There were nonprofit leaders in those classes. And I wasn't even sure if I wanted to do that, but I had talked to one of the program leads and had talked about my father and how my grandfather had worked for a little while as a student in the ashram of Mahatma Gandhi. It was family lore, that we would talk about that. And I think just the idea of service, the idea of having this vision for giving yourself to your community and supporting community somehow really captured me. And this MPA program seemed to have elements that I wanted to understand. So I took the program and made a lot of really great contacts and friends through this program. And afterwards, I joined I should just say that part of the program was a 3-month internship in Senator Maria Cantwell's office. And I didn't really work closely with her, but I worked with her communications director. And her communications director was an excellent mentor. And after I finished the MPA program, she offered me she said, I'm the chair of the foundation board of NARAL, Pro-Choice Washington. We're looking for somebody who could sit on our board that has a healthcare background because we want to look at medically accurate sex education. So I said, well, that sounds great. I still went back to biotech to work, but I ended up volunteering on different boards. This was the first one and the most interesting one. And basically what happened was during this time, there were pharmacists who were advocating for if time-sensitive medication was needed, particularly emergency contraception, that pharmacists should be able to refuse to dispense that if they had a religious objection. And that was concerning, of course, to NARAL, but it was also concerning to me. So I went as an independent individual citizen and testified as a pharmacist to the Board of Pharmacy, saying that this is a really slippery slope. If we don't use science and if we don't use our training, if we don't look at medicine in a way that's evidence-based, then if somebody just doesn't believe that this medicine can work, then a lot of people don't have access to it. So I went ahead and testified. As it turns out, the pharmacy board passed this rule that said that pharmacists could, in fact, not dispense if they had a religious objection. And the governor at the time, Christine Gregoire, was not happy with that, and she ended up not reappointing 2 of the members. So I applied to be a member of the Board of Pharmacy. Now, it's not a very exciting sometimes job. It's like a lot of regulations, a lot of, it can be kind of boring, but it was very exciting at the time because it was kind of the tail end of this discussion. They had a lot of community organizations, a lot of women's organizations that were fighting the Board of Pharmacy. So we went back to the rule and we looked at it and adjusted it and said, that if you are a pharmacist and you don't want to dispense this medicine, that you need to give it to another pharmacist or order it from somewhere else so that it could be delivered right away in a time-sensitive manner. And that covered all medications, not just emergency contraception, but of course that was the most controversial. And that rule passed our board, and it was appealed by pharmacies and pharmacists, one that was in Olympia and others, and it wove its way through the courts because the original judge decided to stay the rule, and it was appealed by the state and then continued to go all the way up to the court systems, up to the Ninth Circuit, that ended up upholding our rule, and then ultimately it was appealed to the United States Supreme Court, and the United States Supreme Court decided not to hear it. So that rule was upheld. It was sort of the first time that as a pharmacist, somebody who really hadn't been in governmental or public administration type role, that I saw the impact of just having a voice at the table as a healthcare professional. and making a difference in law and policy. So I think that kind of sparked my interest originally into looking at, becoming a Democrat, going into public service and applying and running for office.
And so let's come back to your son, right? Because this might be a good way to tie into how that also motivated you to run for public office and become, serve on the city and then the state, and now as a state senator. So talk a little bit about that.
Yeah. So, when we moved here, it was a really great opportunity for me to be with him. So that helped to go to school and to be home when you got home from school, and be able to investigate all that. But I would say that the story that I do tell about him is that when he was born in 1993, the Family and Medical Leave Act was passed, the federal version. And that allowed you to stay home for, I believe it was up to 8 weeks. And then you could take unpaid leave for up to 21 weeks. And so I did that because he was small when he was born. He wasn't a preemie, but he was small. And I didn't have any family support system there. And so I was able to breastfeed him at home, give him a strong start to life, and get a job back in the Upjohn Company. And they had this great position that was opening up in clinical research. And I was able to get this position and work on an antibiotic, help design the trials and write the trials and do some clinical operations for this antibiotic that was called linezolid. And this antibiotic treated gram-positive resistant bacteria. Very flesh-eating, very difficult to treat. It saved thousands of lives. And it did, at the time, was pretty miraculous. And it was considered a serendipitous find and very impactful. And it was 100% biologically available, meaning that if you gave it by IV, it would be the same as if you took it orally. So it had a lot of different uses. People wanted to protect it, of course, infectious disease. Clinicians wanted to protect it because they definitely knew that mutations could arise so that the antibiotic wouldn't be effective. But it was pretty significant, and it was a great achievement for the company. And I was very proud of it. And 20 years later, my father had been diagnosed with cancer. It was a mass, and they removed it, but he had a terrible infection afterwards. And they were trying all different kinds of antibiotics, but when they tried linezolid, that's the one that worked. He's ultimately succumbed to the cancer, but it kept him alive for us to have time with him. And I just remember sitting beside his bedside, looking up at that bag, that IV bag, and seeing this medicine that I had a hand in helping to develop, and realizing that, the policy of the Family Medical Leave Act gave me the chance to stay home with my son, give him a strong start, keep my economic power, by getting my job back, not just any job, a job where I could use science and my skills to help work on medicines, that saved lives. And ultimately, 20 years later, saved my father's life. And I think that is the power of policy, and that's the power of effective government. And when I go to work every day and I think about the policies that I want to be a part of, I think about not only solving big problems, complex problems, because that's exactly what biotech is, solving, let's cure cancer today. Let's get a team together and do that. It's solving big, complex problems, but it's also removing barriers so people have the potential to thrive. And it's a privilege and an honor to be able to do that work.
So here you are, you've now been in politics for almost a decade. And you've served at different levels. Today, you're serving as a senator and you're running again. So talk a little bit about that investment and what you are bringing to the role.
So being trained as a healthcare professional is really unique in government and in policy. I'm surrounded by really amazing public leaders and thinkers, but also a lot of lawyers and people who have come from many different walks of life. But in the Senate, I'm the only healthcare professional, trained healthcare professional that's licensed. There is a few people in the House, but at the same time, when I approach a problem, it's approached with a lot of questions and evidence, because the way I was trained was that if you were going to walk into a room and make a decision, about whether somebody should have this medicine or should do this thing that treated them or improved their quality of life, you better be as right as you possibly could be. You had better have good background evidence and references to ensure those conclusions, and if possible, experience, right? Training. And so I think that's kind of inside my neural pathways. So when I look at policy, I come at it very differently. And I think it's important to have diverse perspectives when we are building policy or considering policy. People who come at things from different backgrounds, different experiences. And that's what I bring. And for a while, I was really shy about it. It was hard. I was thought, wow, I have so much to learn. I would just memorize my speeches, every single word, because I thought, okay, because I was used to using PowerPoints data, not like standing in front of giving these glorious oratories or these eloquent descriptions or, prosecuting arguments in any specific way. I was, really trained to dig deep and kind of nerdy about all of that, right? And so now I realize I can embrace that skill. And I bring something unique to that story. Not only do I fight for science, but I also fight for the ability to be able to think the way I think. And it's been so great and so heartening because a lot of my colleagues really value that. When Donald Trump pulled us out of the Paris Climate Accords in 2017, I was appointed to the State House of Representatives. And I saw that they also cut money to the National Institutes of Health. They changed the CDC website. And it was really appalling to me. And I could see it was shocking to me as a science person, as somebody who had always thought that, data and evidence mattered. And when you looked at the IPCC data that came through for climate, it was very clear that the Earth was heating up in a very rapid fashion with greenhouse gas emissions and human-based greenhouse gas emissions. And so I was really concerned and I started talking about it. And I remember that the chair of appropriations kind of walking away from me every single time I go up to him and I talk to him about something and say, no, Vandana, I know, science. And I'd be like, okay, at least you get it. And I ended up having to bring in Neil deGrasse Tyson video into caucus and showing them, because there's so many issues, right? Yes. With Trump #1, there were a lot of issues. It wasn't just science, right? So why should everybody think about that? And so, trying to sort of say, listen, I've got a niche here. I can help you with this. And this is something I care about. Let me take this on, right? That was kind of my message to my colleagues. And they were great. And honestly, I felt very supported over the 3 years. And we ended up passing greenhouse gas emissions targets that were the most aggressive in the nation, at least, and most aligned with science. I was very proud of that. All of our climate policies now are based on those targets. And I still remember, I have to share this up there, I still remember people saying, why do you have to do targets? Why can't we just do the thing, solve the problem? Which is a big question, right? And I thought that was sort of from the science perspective, but my healthcare perspective came in the answer as well, because I started to say, well, if your cholesterol is too high and you would get a heart attack if you don't bring it down, that's a target, right? To target that number. Yeah. And how your diet, your exercise, or your medicine, right? But if the target changes, if the science changes, and said that original number is no longer accurate, it would be really good to know. And so that is why we have to have targets for the goals that we set in science.
So you are clearly driven by purpose. So talk a little bit about why purpose is important to you and how that is showing up in your work.
I don't often think about the impact that I'll have, but I do think that the purpose that I have is what can I do to remove barriers for people? I feel like that has been obviously a purpose. When you're talking about moving through life, it wasn't a linear path. It was a nonlinear path. It was a development of skill sets and learning that created, if I had been in public service 20 years before I was, what kind of a public servant would I be versus somebody who'd gone through science and industry and all of that? I think that opportunities come up. And so what I often tell young people is I'll say, I was knocking on a lot of closed doors at times in my life when I thought, okay, I think I should be here. I think I should be, at the Gates Foundation. I think I should be here doing this or doing that. sometimes it's not what you think. Sometimes it's what door opens for you. You know what I mean? That doesn't feel like it makes any sense. It doesn't seem like it's an obvious choice, but it's like this one, leader of the MK program, really being fascinated about my family and my grandfather and talking about why this might be a position or a class or a course to take. And just trusting that, that was an open door. And so I start telling people, just walk through the open doors. Sometimes it doesn't always make sense. Obviously within reason, but, it doesn't always make sense. But those are the doors where people really want you, are really thinking about you, have some connection to you. And if it's in your heart at all, you sort of can't stop thinking about it. It's worth thinking about, worth doing. Because ultimately, we don't really all know always what our purpose will be.
I love the door analogy, and I kind of talk about it all the time, that even the door might not fully open. It might just be a crack.
Oh, yeah, that's a good one. Yes.
Right? Just be thinking it.
100%. That's the most.
Like what you see, and then you can open the door. So let's end with you giving us your one golden nugget, a piece of wisdom that you would like to share with our audience.
I have taken a while, like I talked about, finding my voice as a legislator and trusting myself. I would say that the one nugget I would give people is to trust yourself. There's so much that your body and your experience has in your life. And sometimes we have to work through so much just to get to the point where we actually trust our own selves. And the funny thing is, I learned how to do that a little bit my very first year as a House representative. There were so many ideas, so many policies that were coming at me, so many needs in the community, and I couldn't figure out which way to go first. I talked about science there for you, but essentially, there's housing, there's homelessness, there's economic development, there's so many needs for young people, for education, all of that, healthcare. And so where did I want to start? How was I supposed to know what to do? And ultimately, I would just listen to my heart. If something came in front of me, I would listen to my body and my heart. And I had never done that before. I'd always just used my mind and evidence and done the pros and the cons, gone through the data. In this case, I listened because there was so much coming at me. I almost had to find another tool. And so I would just say that a lot of times you don't know what's next for you. You don't know what your role is in life and how you can offer support. But somehow there is a part of you that probably does know. We just don't often get a chance to listen to it as well as we could. And as I've gotten older, I've really been working on how do I listen to that small, still voice that's in us that says, this is it. This is the thing. This could be great. And so I would just say, if you can find a way to trust yourself and use your voice, I think it can be very meaningful.
Listening to your inner voice is really the way in which we should all be functioning.
It's kind of hard to do.
It is very hard to do. Senator Slatter, thank you so very much for being on the podcast and for giving us your one golden nugget. To our listeners, again, purpose is that renewable source of energy that continues to drive humanity forward. Focus on your purpose, listen to that little voice, trust yourself. Thank you all very much. Vandana, thank you so much.
Thank you, Akhtar. It's a joy to be here with you.